Let's talk about veneer preparation reduction requirements. One of the biggest questions I get asked from other dentists is how much do I need to reduce the tooth for veneers? First, we need to realize that we're reducing from our end goal. This is why smile design is so important to veneer cases. If you know your end goal, you're just trying to work backwards. This is especially important when doing no prep, prepless, and minimal prep veneers. The basis for reduction is to make space for our restorative material from the end goal. There are two main materials we use for our porcelain veneers in our office: layered porcelain, also known as feldspathic, and pressed or monolithic porcelain, also known as emax. To determine the basic veneer reduction requirements, I've taken the averages and minimal preparation requirements of layered porcelain, feldspathic, and monolithic porcelain, or emax, in order to simplify things when doing veneer preps. On the average, we need 1 millimeter incisal space from the end goal for incisal reduction, and then 0.3 to 0.5 millimeters facial space from the end goal for facial reduction. Note that I said incisal and facial space, and I did not say just to reduce this much on every tooth in every case. Every tooth in every case will be different. For every veneer case we do, I utilize an incisal reduction guide and a facial reduction guide from a wax up. I use these guides at the time of the prep appointment to ensure that I have the necessary reduction and clearance for my veneer cases every time. Here are the 6 types of veneer preparations I use. Number 1, no prep. Number 2, prepless. Number 3, minimal or traditional. Number 4, deep elbow. Number 5, slice. And number 6, lingual wrap. Another common question I get asked is, how do you know when to break the proximal contact when prepping for veneers? So here are 6 reasons why to break or open the interproximal contact and do a slice veneer preparation. If there are black triangles or missing papilla, if there are failing interproximal fillings, if there's interproximal decay, if we are changing the widths of the teeth, if we're trying to move the midline, if we're closing large spaces. Recommended burrs for veneer preparations. Here are a few of the burrs that I use during my veneer preparations: a big tapered diamond burr, a straight tapered diamond burr, an incisal reduction burr, a 3-level depth cutting burr with 0.3 millimeters depth gauges, a diamond chamfer burr, a red striped mosquito nose diamond burr. I've created a generalized chart to help guide you through veneer preparations based on case selection and the type of veneer preparation. This chart helps to determine the type of preparation you would consider. For example, if a patient had spaces between their teeth. It also shows the big picture of how we could progress from no prep veneers to crowns. So here's a chart that explains the porcelain veneer case selection versus the type of veneer preparation. Now that you have more clarity on case selection, smile design, overview of veneer preparation,